Okay, I am.
Hearing good.
We got all seven beautiful people back. We still waiting.
We're missing one.
Okay.
And I think we've lost the chat from original
Okay.
recording. So if people can put their email addresses back in, that would be great. Please and thank you.
Thanks, Fiona. Shall we continue?
Yeah.
All right. So, basically started as a result of working in general practice, especially with corporates shortening our consultation time to 15 minutes. Found it very difficult to talk to clients. Didn't feel like I was spending enough time with them to truly nurture the human animal bond that we always talk about, and really felt like as a clinician, I was taking away from the clients when it came to looking after their pets. I had a situation in emergency where a lady brought in her dog and it was vomiting, and we ended up diagnosing a tumor. And I just did not have the time to sit with her and really support her through the grief of this shocking news. So, given an emergency, we run by triage, and in general practice, we're very time constrained. I just felt I had to do something with the view to spend more time with the clients and really focus on the caregiver, because at the end of the day, as clinicians, we might come up with the treatment plan, but it's the owners that are executing the plan at home. So, and that for us to provide appropriate care and for the owners to be able to feel empowered, I felt I needed more than 15 minutes or a consult on the run in emergency. So animal comfort care came about as a result of that. We'll move on to the next slide. That is my smug mug. Um, we'll go through some of these letters and work out what they mean. So I've done my bachelor in veterinary science in University of Sydney. I graduated in 2006. I then did my membership in small animal medicine through the Australian and New Zealand College of Veterinary Scientists in 2010. I did a diploma of management, which is all about communication, internal communication, and communication between your team as well as members of public, and then a certification in hospice and palliative care through the International Association for Animal Hospice and Palliative Care. We'll kind of come back to that and touch base on the IAA HPC later in the talk. And then I did a certification in myomanipulative functional therapy, mostly because both my dogs are senior dogs now and have arthritis and back issues. So I just wanted to learn more about how to be able to manage them at home. So the big question, palliative care versus hospice, and this is a huge, huge, huge area of conversation in human medicine as well as veterinary medicine. And I'll go through a couple of uh, definitions, um, and this is pertaining to human as well as veterinary palliative care, because we are extrapolating a lot of the information from the human side. Um, so first and foremost, we need to know that palliative care is not just for the terminally ill. So hospice is palliative care applied at end of life, but palliative care is a team-based approach for the patient, for their family, from a caregiver perspective, and trying to get all the clinician and the professionals intertwined to provide the best care and best support network for the family of the patient, so that they can provide for the patient in the best possible way. Management of symptoms as well as side effects of medications is paramount in palliative care. So you will find as we go on and we talk more about this that I will constantly talk about integrative approach, alternative treatments, using supplements as well as medications. So this is not a alternative to conventional medicine or contemporary medicine. this is alongside what we can do in order to either um, reduce the symptoms of the disease itself and manage those, and or manage the side effects of the medication that we have to give in order to manage the disease process. There there are a couple of definitions. There's one from WHO. It was released in 2019 that palliative care is an approach that improves the quality of life of patients and their families facing the problem associated with life-threatening illness through the prevention and relief of suffering by early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. So, very broad, but very robust, all rounded definition that came out of WHO. The Mayo Clinic defined palliative care as specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. It can also help you cope with the side effects from medical treatment. The availability of palliative care does not depend on whether your condition can be cured. So this is kind of in contrast to what the Palliative Care Australia 2024 and the Australian Government Department of Health and Aged Care released as a statement, which says palliative care is person and family centered care provided for a person with an active, progressive, advanced disease who has little or no prospect of cure and who is expected to die. Now, for me, from what I've learned through my course and the newer dialogue that's happening in the human world, we are talking about palliative care as a short-term or a long-term treatment plan and advocacy program. We're not specifically sticking to it from an end-of-life hospice care perspective. So there's very little education around the subject when it comes to even internal dialogue amongst medics, but certainly with members of public. I mean, if we don't understand it, so it's really difficult to know what it is that members of public understand. I've had vets refer clients on to me, and the client's first sort of reaction is, "What do you mean palliative care for my dog or my cat? You know, do you think they're dying?" And it's not the same as hospice. Hospice is very much a one-way street, whereas palliative care is a little bit of everything. You know, from a short-term perspective to a longer-term perspective. So managing anything from post-operative orthopedic care to arthritis, which is a little bit more long-term. So yeah, no coming back from hospice, unfortunately. And palliative care definitely includes surgery. So recently we had a case where we had a kitty cat who had potentially memory cancer. We don't know. It seemed like it on palpation. It was in the right location. And weirdly enough, she grew a cyst just at the cranial end. And that cyst was the main issue. The cyst was what was causing the leg to not move properly. So we recommended having the cyst removed as a part of her palliative care process. Because the discomfort wasn't so much coming from the fact that this cat had cancer and the owners didn't want to go ahead with big major surgery. She was a 15-year-old cat, but they were quite open to the idea of having the cyst removed so the cat could be a little bit happier. We did discuss at the time that we might remove the memory tissue as well, but the owners didn't want to do have a big incision. That was kind of their full stop moment. So yes, palliative care definitely includes surgery, and I don't know if this would be a surprise to some of you. Certainly, people who work in veterinary care, dentals are probably the number one issue when it comes to palliative care medicine. I often will send clients to go get dentals at their regular vets, and I tell them, you know, yes, your animal is frail. Yes, your animal's got all these issues, but we are at that point where the mouth is so rotten, your animal's not eating. And of course, without nutrition, you're not going to go, you know, move forward and get over any kind of disease process. And certainly without nutrition, you're not going to survive. So we would get these clients to, in essence, say goodbye when the animal is being admitted for dentals and remove the teeth if they need to be removed, which they usually are, clean them up, and that's the sort of the last procedure that animal will ever have. Um, and that happens more often than I'd like to think, but dental disease is up there when it comes to palliative surgical procedures. And so far, thankfully, I have not lost a patient. My why, outside of what I told you guys in terms of time constraints and everything, was I didn't quite like the idea of this magic number 7, where as soon as animals hit 7, regardless of breed, regardless of species, we would call them senior. We would do a blood test. If everything was fine, we would see them next year for their annual checkup and another blood test. And the things I felt were missing were conversing with the clients about what aging looks like. So it was just really odd to recognize that an animal is now senior, but we weren't talking about skin tags, lumps and bumps, cloudy eyes, reduced hearing, sensory loss, cognitive dysfunction, but we were just doing a blood test and sending them on their way if everything was fine. The other thing was the number 7. What I couldn't kind of quite put my finger on was why we weren't recommending joint supplements for really active younger dogs. When you have a client who comes in with their dog and says, I go for a 10-kilometer run every day, and they're running their dog with them, I would often ask them, what supplements are you on? And they would give me a list. And when I would ask them what supplements their dog's on, their dog wasn't on anything, wasn't even on a joint support diet. So really, early intervention is absolutely paramount in being successful in palliative care. And palliative care can start at any point in the process of any disease, at any stage, at any age of any illness. So we really need to be talking a lot more about aging, and we really need to be talking about palliative care in a day-to-day situation and not just end of life situation. Um, Most people who've been through university vet school, you must have heard this term, age is not a disease. Even though I've had clients say to me, he's slowing down with age just like me. Um, and I've had to explain to the client that that is not um, that is not something we should sort of sit back and just simply accept. If you're slowing down, there's pain or there's something else going on, and it's best to try and get on top of it. Yes, you do slow down, and certain aging parameters are normal. And then there are certain things that are not normal, like your dog not wanting to walk and sitting down on their walks. That's very, very different. So, helping clients recognize signs of pain. Or they will say things like he's starting to lose his marbles as he's getting older. And yes, doggy dementia is a thing. Yes, cognitive dysfunction is a thing, but we really need to tell them that there are certain things that we can do to help their dog navigate this. So, what exactly do we do? We use everything from conventional medicine, so your contemporary medicine. We don't do this instead of using alternatives, or using alternatives instead of using medicine. If a patient with pain needs an anti-inflammatory, they get their anti-inflammatory. But if they have sensitive gut, then we also discuss supplements. The second thing that we do is I'm a huge, huge, huge proponent for physical therapy for myself and my dogs. I think medication only goes so far, and we have a plethora of medication, especially when it comes to pain management, when it comes to musculoskeletal diseases, everything from your pentosan injections to non-steroidal anti-inflammatories, paracetamol if it's not a cat, and using amantadine, ketamine, all of these things. We've got these wonderful drugs, but we really need to couple that with physiotherapy, hydrotherapy, massage, laser, improving their core, doing some rehab stuff, exactly how you would do it for yourself. We provide the clients with a ton of information, everything in writing. Um, my initial consult usually goes for about 2 hours. I will usually set aside about 4 hours for a consult because it takes me about an hour to prep for it, get all the information from other clinics, and then be prepared enough to go into someone's house and do a physical exam. And then about 15 minutes is probably the physical exam. The rest of it is me sitting there and just talking to them. And then about an hour to collate all the information, sending it to the clients, keeping the regular vet interested and in the loop, and telling them, all the things that we've put in place. Um, Having the specialists involved if we need to get specialists involved, physiotherapy, rehab, whatever the patient needs, we put it all together and we continually communicate with the entire team. And if the patient needs follow-up radiographs, follow-up blood work, anything, they go back to their vet. So there's no real conflict of interest here because we don't do what general practitioners do in clinic and they don't do what we do. Lots and lots of talking, lots of talking. That's basically what my job is. I also currently have a client who is getting some pet loss grief support after she lost her dog. So there's additional care even after the pet has passed. We also direct people in all the different directions. A lot of times, this is not just in palliative care through my palliative care service, but in general practice, especially as a locum. I found it a little bit unsettling that, in some clinics, I would see a client come in for the fifth year in a row for skin issues. And when I would mention, have you seen a dermatologist? They would say, it's never been discussed. I didn't know there was such a thing. So always recommending gold standard, or at least making the client aware of what we've got out there, what natural therapies we can use, whatever is scientifically proven, not just throwing things at them till something sticks, what medications can be used, um, and what kind of other treatments, whether it's laser and things like that, especially for open wounds or arthritis. Laser works quite well in those cases. So we tend to put the plan together and direct the client in different locations, or certainly advise them that these other avenues are available to them, just so they're aware that they're not alone in this, and two, there are multiple modalities available, and three, if they can afford it from a time perspective, from a logistical and financial perspective, then they have these avenues available to them. And we have, of course, our recommendation depending on where the client lives. And time. We give them a lot of time. Okay, so in terms of medications, we keep talking about integrative approach. So pills, of course, we definitely we write prescriptions for medications or continue with whatever the regular vet has prescribed, maybe add to it, maybe lower the dose, increase the dose, depending on how the patient is doing, which most regular vets usually have. Whoever the attending vet is for the case usually has worked out what the right dose is for that particular patient. I love CBD oil for skin, for joints, for sort of a generalized neurocognitive effect. One of my dogs who has severe arthritis is an epileptic and has severe anxiety, triple combo that one. She has responded really, really, really well to CBD oil, admittedly at higher doses, but she's on higher doses of absolutely everything because just regular dosages just don't touch the sides with her. So individual plans, but also utilizing our knowledge in multiple areas. Injectables, I have not seen a huge amount done in terms of intra-articular injections. I hear from the surgeons, so I don't personally do them. But I know from personal experience with my specialist for my knees, PRP is absolutely beautiful. Stem cells work. They give you longer term anti-inflammatory effect. And then you've got things like Pentasan. And I really think different clinics do different things. And I'd love to hear what people are doing with Pentasan, Synovan, Cartrophin, whatever the product is in your clinic. Different clinics are doing different things. So some are doing a course of 4 injections, so once a week for 4 weeks, every 3 months. Others are doing once a week for 4 weeks, then monthly, which is generally where I go. Um, and then some are just doing once every 6 months. So very confused about that. I generally tend to go by individual response, especially with something like Pentosan. We know it helps lubricate the joints, keeps the synovial fluid more viscous, hence having an anti-inflammatory effect. And it also helps lubricate the myofascial plane, so your muscles move a lot smoother. Couple that with some massage, and you're going great guns there. Last but not least, those are not magic mushrooms. Those are, well, that's just a photo of generic mushrooms, but there are certain scientifically proven mushrooms when it comes to things like bleeding disorders or hemangiosarcomas, where we don't want new blood vessels forming. So Dr. Rob Silver is my go-to for cannabinoid therapies and my mushroom therapies. He's kind of the OG when it comes to these two things. In terms of pushbacks, we received a few. One was a vet saying that there was a conflict of interest. He was worried I would take away his clients. I assure you, I will not take away your clients. My job is to work with you, not against you, and share the client and share the client load. That's where we come in as palliative care service. The other one was a very interesting one. This is somebody I've worked with, incredibly intelligent vet. And taking me on as a locum, he asked me if I would euthanize a patient if it was clinically indicated. And I said yes, but I also thought, I wonder what he thinks I do. Where is this coming from? And clearly there's a complete lack of knowledge. Either people think we're voodoo and magic dancing in the moonlight in the forest, or that I don't really know, or that we euthanize, we're end of life only. It's very confusing as to what the people know. So we're actually kind of running a survey at the moment, just in terms of you know, whether pet owners, where pet owners are with their relationship with their vet. But I do want to send out another survey where we're talking more about what do you know about palliative care, and did you know this, and did you know that. But I would love to send that to some of the vets, because you know, you would like to think that your colleagues know a little bit more, but if it's not being taught at universities, then how are you supposed to know? Um, some people became a little bit defensive, feeling as though us providing an alternative service meant that we were stepping on their toes, or that we were basically saying to the client that your vet didn't do a good enough job, when that is not at all what this is. My job as a palliative care vet is to advocate for the patient, for the client, and the client can be one person or it can be the entire family if the family is involved with looking after the animal. Um, and also advocating for the veterinarian, the specialist, the physiotherapist, any allied health services. So strengthening what you guys do to the client, so the client is more likely to rely on your services. And we know at the end of the day, together, we can come forward with a plan that works best, and we can have the best outcome for the pet. And that's kind of your, you know, that's your aim at the end of the day. So yeah, hit me up with any questions. I'd love to hear more about if you have alternate thoughts, and if you have any queries. But yeah, I would like to think that we're helping everyone involved, but obviously there's still a lot of confusion in terms of what it is that we do. Now, this is a QR code, and I know it's blurry, but I checked it yesterday and it works. This is anybody who is a student. You can become a member for the International Association for Animal Hospice and Palliative Care for free. And this is a very, very cool time to do it because they just upgraded their website. Thank God. And I keep saying they. Fact is, I'm on the board of directors, so really we. have just upgraded our website. But yeah, there's a lot of information there now. There's a webinar library, online learning. We are trying to also collect a lot of articles around palliative care and hospice and palliated death, and put it all together under the one roof, because there isn't so much information out there, and we don't want people, well, we didn't want to go searching in different corners of the world. So we kind of want to bring it all together, and put it under the one sort of umbrella so people can find the information pertaining to the subject matter quite easily. I'll leave that there for another 5 seconds, but go ahead if you want to go through it, or you can take a screenshot and share it with students who can become members. They also do short and longer sort of certifications, and their certification for hospice and palliative care is for vets, vet techs, and allied health people as well. So they're not, they're not just doing the one thing. All right. So I'm a vet. Ask me anything. All right. Any questions? Queries?
I think it was interesting that vet wanted to know what your stance was on
euthanasia.
Yeah.
I was very curious because I'd worked with him before. And I was very curious. I was like, what do you think we do? Keep them alive forever? And that's not it.
Yeah.
Because it very much is it's a matter of improving their quality of life, whether it's end of life or, post surgery, or just been diagnosed with diabetes or kidney failure, whatever it may be. At the end of the day, we're trying to improve their quality of life, but that is not at the cost of the animal or the human animal bond. Of course, there are situations, and I've seen people kind of talk about palliated death, get my words right, where, for example, Buddhist clients or somebody with religious or personal or cultural belief don't want to euthanize. Obviously, I'm not going to snatch their animal and put it down. There are better ways of doing it, and that was something certainly we were not taught at university about palliating death. So essentially, what we do with people, but doing it with an animal, but also giving them medication, because these people are not they're anti-killing, but they still don't want their animal to suffer. So there's a little bit of everything that we have to deal with, like that vet saying, are you going to put it down? Are you going to be comfortable euthanizing an animal if it's clinically indicated? Of course. But also that depends on the client, if the client is on board. Anything else?
What's normally the turnaround time from when someone contacts you to you can have a sit down with them?
Less than a week.
Less than a week.
I usually do my consults out of hours because that's when people are home. So there's no out of hours fee because that is the business. And that way I often, especially in situations where mom and dad have to be there, and usually they're the ones arguing and fighting and can't come to terms with how they want to proceed, or you've got a family where there are multiple caregivers involved, it's easiest for me to go and see people out of hours when everybody's home.
What are you doing, I guess, to try and combat the pushback from other clients?
Education. I don't care if it's one person or 100 people. I'm just going to talk the talk and walk the walk. And hopefully they eventually start to see the benefit in working in a very collaborative way. I was recently watching this show where in the emergency department, they had a social worker whose job is basically looking after the families because obviously they're going through a lot and they're quite shocked. And in essence, I see myself as that person. And in the US and in Canada, I know there are palliative care services that include social workers as a part of providing the palliative care service, in order to provide a more well-rounded service to the family, not just in terms of all the clinical stuff that we have to do with the pet, but also in terms of a lot of hand holding for the client. People are very attached to their pets. So they need that added emotional and sometimes spiritual support. So it's always good to have somebody there to help with that. So we just keep talking and we keep sharing information, and we keep educating. That's all I can do, really. Any other
Not so much a
questions?
question, but
Yeah.
a comment. When I lost my last dog, I was in such a state of disbelief, and I was so distraught that I think I didn't understand what my options were or what I really wanted for me or for my dog.
Yeah.
Whereas now I think after talking to you and learning so much more about what the options are, that I just feel so much more comfortable that if something happens to Ruffles, my current dog, I'll be able to actually make much better decisions for us both. So thank you for everything you've
Oh,
taught
thank
me.
you. Thanks, Denise. Of course. I mean, we often find people who are feeling a bit stuck, um, or or sometimes when they know it's time, but it's hard to make that decision. So having somebody on your side and someone who can give you a clinical perspective, but also emotionally be there for you, it makes a huge difference.
For those that are still working in clinics,
Yes.
is there something that you would hope or would like them to do, I guess, to help you out
In what way do you mean?
for education and for
I mean,
getting the word out that they like you are an option?
yeah.
Yeah.
I reach out to vet clinics with the view to do lunch and learns and doing educational talks. I would love for them to even just call me direct and say how, what exactly is the service that you provide and how do you believe it would complement us, and then we can talk about it. We really need to get the conversations rolling, and I know it's going to take time, and I mean, it's taking time in the human side. So it's definitely going to be slightly delayed when it comes to the veterinary aspect. But we really need to just continue to talk about it. And also, as I mentioned earlier, I like the idea of sharing the client load. You are busy. The business model in general practice is all day consults, procedures. You get a little bit of a break, and usually that break is phone calls and pathology calls and all of that. So why don't you let us do some of the talking for you, and we'll send them back for all the things that you need to do, but your client still feels empowered and strengthened by the two of us working together. They have a team now to help them through whatever the disease process the poor patient's facing. Did that answer the question, or did I veer off on a tangent?
No, that did help because it's like in the mindset of like they're happy to send to an emergency center overnight, but there's
Right.
also like the pushback for you. It's like, what's the difference?
Yeah. Yeah.
Yeah, they
I
still
mean,
go to emergency overnight and then they still get shipped back to you in the morning.
right.
It's yeah.
And having worked in emergency, I can tell you right now that in emergency, we face pushback where people say, "Oh, you could have left it till the morning, and you took our case, or you ran the diagnostics, and it didn't need to be run." It's well, one, when you're faced with the client, you can't not do those diagnostics. And two, I'm not working against you. I'm trying to work with you. We try to stabilize the patient and send them back to you. But in certain circumstances in emergency, that is not possible. With palliative care, it's a little bit different because it's an advocacy program. It's just a lot of talking, a lot of information, a lot of hand holding. And then once the consult is done, I'm available by text or by phone call or email to my clients. They have a different number given to them, and I can be there for them without stepping on the regular vet's toes. They do the blood work, they dispense the medication, they do the imaging, they do everything else. Anything else? Pretty complete.
Yeah, I think there hasn't been any questions come through the chat yet.
Okay.
Cool.
Palliate every day with things like sugar and chocolate. It will harm us, but it improves our quality. I love that. Thank you, Amanda, for sharing that comment. Did you read that? All right. I'll let you guys go and get on with your Monday night. Thank you again for being patient with, I want to say technical glitches, but really it was me glitching. So sorry about that.
It happens.
Thank you so much. Bye, everyone.